The Health Care Reform Act, better known as Obamacare, has many scratching their heads. So what is it? Who will it benefit? And how will you be affected?
It's an attempt to make a much larger portion of the American population insurable, so that they've got health insurance and so that they've got a policy.
Obamacare is mainly Medicaid expansion, funded by Medicare cuts, new taxes, and higher insurance premiums. Dr. Jordan says those who really need to understand the health care reform are those with Medicare and business owners.
Or more Medicaid, maybe less services for Medicare patients, and what is going to be the effect on employment.
Less doctors will see patients with Medicare, and businesses now have the option of paying a fine rather than providing employees with health insurance. Yet everyone is still required to have insurance. If not, you will be fined.
The government has to have everybody in some kind of insurance policy because they need that money to fund the Affordable Care Act.
Texas can choose not to accept the Medicaid expansion, but regardless, many will sign up for the Medicaid because of the penalty they face.
Whether the governor decides to accept the Medicaid expansion or not accept Medicaid expansion, it's going to have that bill to come in. There'll be a higher percentage of Medicaid in the Texas budget.
Funding for the newly eligible will be funded 100% by the federal government until 2017. Then they pay 90%. The question is, how much will that percentage change after 2020?
I do think anytime that new fees or taxes come into play, there are repercussions. It's just that we don't know what the effect's going to be long term until we actually kind of go through them.
Fenstermaker says a positive she sees is that everyone will have uniformed insurance, but that funding and when and who will foot the bill is still a concern.